The history of the Medicare Planning Fringe Benefit. This is Charles Wright, Principal Advisor with Health and Wealth Advisors in Orlando, Florida. In 2017, while conducting research for marketing materials being submitted to CMS, I discovered a source of massive waste affecting the Medicare program. The Medicare secondary payer statutes were enacted in 1980 to protect Medicare from paying medical claims of self-insured employer health plan members. The unintended consequence is the MSP statutes have prevented Medicare-eligible health plan members from easily transitioning to Medicare. It is estimated this problem has cost employer health plans and health plan members more than $1 trillion since 1980. In April 2019, with the support of Congresswoman Val Demings, I presented recommendations mitigating this problem to CMS, the Department of Health and Human Services, and the Health and Human Services Inspector General. August 2019, CMS responded, stating, though a small number of Medicare beneficiaries are automatically enrolled in Medicare Part B by mistake, changing the Medicare secondary payer statutes as proposed would not be in the best interest of the Medicare program. This CMS response motivated the creation of the Medicare Planning Fringe Benefit in September 2019. November 2019, the National Association of Health Underwriters asked CMS to conduct a compliance review of the Medicare Planning Fringe Benefit to determine if it violated the Medicare secondary payer statutes. CMS concluded the Medicare Planning Fringe Benefit is entirely an educational material, requiring no further review by CMS. This conclusion by CMS mitigates compliance risk exposure associated with implementation of the Medicare Planning Fringe Benefit. March 2020, I began collaborating with Lewis & Ellis, consulting actuaries, to apply actuarial methodology to quantify the cost-saving potential of the Medicare Planning Fringe Benefit. Josh Hammerquist, Vice President and Principal at Lewis & Ellis, determined the actuarial lifetime savings of compliantly transitioning each eligible plan member to Medicare is $76,500. August 2020, Dale Hall, Director of Research at the Society of Actuaries, challenged me to write a white paper explaining the Medicare Planning Fringe Benefit to the actuarial community. The white paper was completed in October of 2020. May 2021, the white paper was published by SHRM, the Society of Human Resource Managers. May 2022, the Society of Actuaries published the sponsored white paper in their publication, The Actuary. You are encouraged to download the Medicare Planning Fringe Benefit white paper from this website. Assume a healthcare system has 5,000 employer health plan members. 10% of the health plan members are age 65 or older, representing 500 Medicare eligible plan members. The healthcare system is self-insured, paying plan member medical claims from their balance sheet. Single plan members pay $5,600 in premiums annually. The healthcare system's average annual cost of coverage for each Medicare eligible plan member is $25,000. Medicare eligible plan members cost the healthcare system a minimum of $12 million annually in medical claims. Transitioning 80% of the Medicare eligible plan members to Medicare can potentially save 400 Medicare eligible plan members more than $2 million in annual premiums and save the healthcare system more than $10 million annually in reduced benefit costs. Today, your organization will be presented the opportunity to achieve this magnitude of benefit cost savings in a manner compliant with federal law. The 2020 Kaiser Family Foundation Employer Health Benefit Study found the average annual employer health plan contribution to be nearly $16,000. The average annual plan member contribution is almost $5,600. Most eligible plan members would be better served with a suitable Medicare plan. Most eligible plan members choose Medicare Advantage plans with $0 monthly premium. After the eligible plan member enrolls in Medicare Part B and transitions to Medicare, the plan sponsor saves an average annual benefit cost of nearly $16,000 per eligible plan member, and eligible plan members save between $5,600 to over $10,000 in annual premiums and cost-sharing expenses. Everybody wins. Large employers have the opportunity to reduce employee benefit costs significantly by offering the Medicare Planning Fringe Benefit to Medicare eligible plan members. These cost savings are accomplished by educating Medicare eligible plan members about how the Medicare program works. Eligible plan members receive a customized Medicare plan comparison report. This report documents the known costs of the plan member's most suitable health care plan options. Exposure to this cost-saving information, along with consultations with a benefit advisor, compels most Medicare eligibles to enroll in a suitable Medicare plan. The Medicare Planning Fringe Benefit provides a compliant process for transitioning Medicare eligible plan members to the most suitable Medicare plan option. Plan sponsors and plan members benefit from significant cost savings as a result of the employer offering the Medicare Planning Fringe Benefit. Mary Smith just turned 66 after working for the Acme healthcare system 20 years. Mary plans to work until she's 70. Her husband John is 67 and retired. John is a dependent on Mary's health insurance plan. John has Medicare Part B. Mary pays $400 a month for their Acme Group Health Plan. If John wasn't on her insurance plan, Mary would pay $200 a month for health insurance. Mary learned about the Medicare Planning Fringe Benefit that helped her understand their Medicare plan options. Mary and John completed the Medicare Fact Finder. After receiving their Medicare plan comparison report and completing the telephone consultation, Mary and John made some decisions. Mary has decided to enroll in Medicare Part B. Then she and John will enroll in $0 monthly premium Medicare Advantage PPO plans. Mary and John's transition from the Acme Group Health Plan to Medicare Advantage plans will save them over $7,000 a year in premiums and cost-sharing expenses. This is what Mary Smith's Medicare Plan Cost of Ownership Summary looks like. Your company is invited to sponsor a Medicare Planning Fringe Benefit pilot project. This is an opportunity for a minimum of 25 to a maximum of 100 eligible plan members to experience the Medicare Planning Fringe Benefit. There's no charge for participation in a pilot project. When the pilot project sponsor proceeds to full implementation, a $1,000 service fee will be charged for each of the sponsor's eligible plan members. Project sponsors are responsible for fees associated with production of the actuarial opinion required for each pilot project.